Hello, I'm going to show you guys what to do if someone has a snake bite. Snake bite is a medical emergency. What is most important is to remain calm. What I'm going to do is a first aid on what you do so that the person who has a snake bite is not going to run into trouble. I'm going to start with telling you guys the local symptoms of a snake bite. Then I'm going to talk about the systemic symptoms. The local symptoms of a snake bite is one, usually is in the extremities. You're going to have a puncture mark around the site of the bite. Then there will be so much pain, and there might also be swelling. There might be some bruising, and there might also be bleeding. It depends on the type of venom. There are venoms that are neurotoxic, and there are venoms that are hemotoxic. The idea of this first aid is to make sure that someone who has the local symptoms does not degenerate into the systemic symptoms. Now let's talk about the systemic symptoms. These are symptoms that affect all the organ systems, and these are symptoms that would actually make someone to die, and that's what you don't want. Those symptoms would include maybe sweats on the forehead, generalized swelling, feeling faint, feeling dizzy. Some might actually have difficulty with breathing, or they might be breathing so fast. Some might have very fast heart rate. Some might actually have hypotension, what we call shock. Some might have tinglings on their extremities, or what we call paresthesia. Some might also have internal bleedings. If one develops these systemic symptoms, it's getting too late. So if you focus on what I'm going to tell you on the first aid, you will prevent one who has had a local symptom from degenerating into the systemic symptoms. Now that we know what happens when someone has a snake bite, let us now focus on what we do. How do we save this person's life? There are 3 things that I want you to remember that you have to do. There are also 3 things that I do not want you to do. What are the 3 things that I want you to do? First of all, you want to elevate the head of the patient. Put something at the head. The idea of putting something at the head is to move the head and the heart up so that the position of the heart will be higher than the position of the extremity where the bite has happened. The moment you have done that, then what is most important, please remember this, is to immobilize that limb. You have to keep that limb still. Why do we do that? You don't want the muscles to be pumping, because if the muscles pump, they will push the venom into the big central circulation. That's what you do not want, because those are the things that will give you those bad systemic symptoms that I talked about. So immobilize the limb. If you have an immobilizer, you put it there. If you do not have an immobilizer, you could actually tie the 2 legs together. Put a piece of cloth in between and tie the 2 legs. What you're trying to do is to make this leg not move. So immobilizing the leg is most important. The other thing that you do is to put a little pressure at the site of the bite. If you have any piece of gauze or anything, just put it there, put a little pressure. The reason why you're putting this pressure is to prevent lymphatic drainage. There are vessels, I will call them vessels for the purpose of this discussion, that are very superficial. They're almost beneath the skin. And some of the neurotoxins travel through those lymphatics. So you want to put a little pressure so that there won't be flow of the poisonous venoms through the leg into the systemic circulation. You don't want that. Then the next thing you do is that if you have a bandage, this is what I have in my hand. If you have a bandage, good. If you do not have a bandage, use any piece of cloth and then tie it from, I'm going to demonstrate that now. Tie it from that site. Please do not make it so tight. Do not make it so tight. The idea is that you're trying to prevent lymphatic drainage from moving up. You're not trying to prevent venous circulation. Just keep doing it. Tie it up. Some people will tell you to make sure that you tie above and below and above 2 joints. The idea of trying to see if you have tied it so much is to see if you could easily slid your fingers under. You should be able to slid your fingers under. What you don't want is for it to be too tight and then prevent venous circulation. You don't want that. So remember what I said, You have immobilized this leg, you have tied on the site of the injury and tied up above the knee if it is the leg. And these two limbs are already immobilized, and then you start moving the patient to the hospital. The three things that I do not want you to do is to suck the venom out. There are some traditions that believe that they put their mouth and suck the venom out. Please do not do that. The other thing that I don't want you to do is to use knife to cut open the site of the wound. Please do not do that. The last thing is to put a tourniquet. Do not put a tourniquet. If you put a tourniquet, you're going to prevent venous drainage, and that leg will swell even more, and the leg actually may get ischemic. Do not put tourniquet. Now, those three things I told you to do is to immobilize the leg, apply the bandage, and then start going to the hospital for expert care. Immobilizing the leg and applying the bandage is called pressure immobilization bandage. The moment you have done that, you've stabilized this leg, you've immobilized it, you've applied the bandage, then you're going straight to the hospital. If you get to the hospital, a couple of things are going to happen. One is that you have prevented the local symptoms from developing into the systemic symptoms, and at the point you get to the hospital, they should take over. What they're going to do is to give the anti-venom, and then they will watch for any of those systemic symptoms. If any of them exist, they will do an organ system support. Hi, my name is Dr. Odiraa Before. I'm a pediatric intensivist and an associate professor of pediatrics. I hope this was useful. Thank you so much.